Today we're going to be talking about how to reduce anxiety in dentistry. I'm so happy for you to be here. And please stay till the end because you're going to be learning new terminologies, you're going to be learning new things. So this topic is called From Scared to Smiling, Maria's Journey. I'm going to talk about Maria's story. I'm sure you all know a Maria, someone who is always nervous when going to the dentist. They feel that dread in their stomach in knots. So I'm just going to try and explain things to you in simple language. Please stay till the end to gain from it. That is fortune. So what are the learning outcomes? To know about the TellShowDo technique, which I normally use, and simple terminologies. So as you can see, this is Maria. You and I know a Maria, someone who dreads going to the dentist, or people who have never been to the dentist for 10 or 20 years because they are scared of going. And the sad thing is, the longer you leave it, the worse it becomes. It's best to come in for a regular clean and polish rather than wait and have decay and it hits the nerve and start keeping you awake and makes things more complex. It's best to start doing simple things, just gathering the courage to come and do something simple like a clean and a polish. So, what is a compassionate dentist? A compassionate dentist, we all have our definition of what a compassionate dentist is. A compassionate dentist should be kind. A compassionate dentist should have a rapport with the patient. Compassionate dentist should allow the patient to share in the decision. I practice shared decision making. You and I come to an agreement on what is best for you. And also, a compassionate dentist is kind. A compassionate dentist uses simple language. Compassionate dentist tries to relax you and respect your wishes because there are times, for example, people may come and say, I don't want this, I don't want that. And at times you've got to, after explaining the pros and cons, the complications, risks, alternatives, benefit, pros and cons, it is also good to respect the patient's wishes because we are all different. And also, it is also very important to pretend to walk. This is a metaphor to walk in the patient's shoes, how they are feeling at that moment. We should need to respect people's feelings, how they feel about certain things, and respect different cultures. So, for example, if people are fasting, there are certain treatment they would not want, or they would like you to minimize things and not to use water or things like that. You need to respect that. So, what are the qualities? I can really break it down into being empathetic, kind, and patient centered. So, what is empathy? Empathy is a form of emotional intelligence. Emotional intelligence has got other things that come under this topic, but mainly, to keep it simple, is feeling, trying to feel, walk in someone's shoes. How does it feel like to be in that person's shoes? Yeah. And also listening to the patient is very, very important because when you listen, you are able to understand what they want and building that rapport, coming to an agreement with them, singing this from the same sheet, coming to an agreement about something is very important. And being kind, being mindful, using the TellShowDo technique, which I'm going to talk about, using simple language to explain things, and as I said, getting the patient involved in the treatment planning. I practice shared decision making. To me, it's very important that you and I come to an agreement and work towards a goal. We should be smart and respect your wishes and should be tailor made to you because there are certain treatments that need to be tailor made specifically for you, taking into consideration other things. It cannot be one glove for all, if you know what I mean. So what is the TellShowDo technique? The TellShowDo technique means I'll tell you something and then show you what it is and then do it. So for example, if I'm going to do a simple scale and polish and I'm going to be using the polishing brush, I'll tell you today I'm going to clean your teeth. I'll be using a special machine to clean your teeth and it gives water. That's the ultrasonic scaler. So we pretend your tooth is your fingernail. So I'll try it on your fingernail. And if you're happy, before I try it in your mouth. So that is, I'm telling you and I'm showing you what it is and then I'll do it. And this reduces anxiety because you understand what I'm going to do. I'm not taking you by surprise. So if I'm going to polish, we can use the bristle, show it on your nail, how it is done, and then do it. If it's suction, we can use your hand and suck it so you feel how the suction works. So you're not taken by surprise, and then we do it. Yeah. So this is an example, and I've developed some terminologies to make the experience a little bit kinder for people. For example, the dental suction, after demonstrating it, I've given it a name. It's similar to a vacuum cleaner suction. You know, when you use a vacuum cleaner at home, the hose, it's just similar to the suction, the feeling. So that is what suction does. It takes away the saliva and water while the dentist is working. And then I've also got the 3-in-1 tip. In this picture is the black thing that is showing there with a tip, and it can blow air and water, and I call it Mr. Windy Bendy. So this is Mr. Windy Bendy. So I'll blow air on you so you know what it feels. At times we use it to test if the tooth is sensitive, or we use it to wash away debris from the mouth. So the 3-in-1 tip, I call it Mr. Windy Bendy. So I'm going to use Mr. Windy Bendy. I'm going to show you how it's going to work, and then I use it on you. Another thing is the dental chair. So I call it the magic chair. It's like going for a ride. So sometimes I let the patient try the buttons to see how the chair moves, and I say, "Wee!" It goes up, it goes down, and you can come out of the chair, have a feel of the buttons on how the chair goes up or down with your feet, so that you feel comfortable when you sit in it, and you're not taken by surprise. And then clean and polish. As I said, this is manual clean and polish using a manual toothbrush, but we do have professional clean with the dentist or the hygienist using a ultrasonic scaler or a hand scaler, which is very important if you want to maintain your gums, if you want to have healthy gums and a confident smile. And then we have special brushes called interdental brushes. I call them special because they are for cleaning in between the teeth, and we have different types, maintaining oral hygiene. So even though the dentist can help you with professional cleaning, you also have a duty to do yours at home. And what is prevention? I've always been passionate about prevention is better than cure. So what can you do to prevent dental decay and also to reduce anxiety from coming to the dentist? Is to maintain a healthy gums and confident smile. So you brush twice a day, floss, limit sweet to meal times, visit your dentist regularly, visit your hygienist regularly. And voila, you have a beautiful teeth and a beautiful smile just because you've come to see the dentist, and you feel confident because it's good to feel confident. Your smile. Some people never smile because they are not happy about their teeth. That's why it is important to visit the dentist and the hygienist regularly. As a disclaimer, anything that I share with you is just for information. It's not, it's for general information purposes, and to emphasize that prevention is better than cure. So it's very important that this is a disclaimer. I'm only creating these videos to educate, to share knowledge, and also to empower you to practice dental prevention is better than cure, to have healthy teeth, healthy gums, and confident smiles. Thank you for listening, and thank you for staying till the end. See you in my next video. Thank you.